Good morning. It is a pleasure to participate in this 10th TDCPP forum. My name is Erica Sela. I work in Innovatec in Spain, and together with my colleague Radwan from the Egyptian Center of Innovation and Technology Development, we are very happy to share and present to you the results of the scientific and policy mapping of personalized medicine in Africa. This scientific and policy mapping is the first activity of the project. It was carried out from February to September of this year, and it had the objective of gaining a better understanding of the scientific and policy landscape of Africa in personalized medicine. We wanted to know which were the researchers and research groups working in personalized medicine across Africa, in what areas, with which countries they were collaborating with, what were the policies and the programs and funding activities related to personalized medicine in each country. This was carried out in two tasks. The first one was a bibliometric analysis to identify the major scientific outputs in Africa related to personalized medicine. And the second part is reviewing the health research and innovation policy landscape, focusing on activities related to personalized medicine through desk research and a stakeholder survey. This has been a collective work of some project partners. It was coordinated by Innovatec and ETIP, and also had the contribution from the African Population Health Research Center in Kenya, the National Council of Science, Technology and Innovation in Kenya, also the South African Medical Research Council, the Eastern Central Southern Africa Health Community, and the African Union Development Agency, AUDA-NEPAD. The first part of the presentation will be the scientific mapping, and it will be given to you by my colleague Amr. So Amr, please, the floor is yours.
Thank you, Erica. I'm glad to be with you today presenting our findings regarding mapping the scientific landscape of personalized medicine in Africa. I'm Radwan, and I represent the Egyptian Center for Innovation and Technology Development based here in Cairo. We designed our bibliometric study to answer specific key questions on the themes and the trends of personalized medicine in Africa. So we structured the study into three main pillars. We looked first into identifying key institutions and research groups. And second, we assessed the main research areas and disease categories of interest to African researchers. And third, we analyzed the overall trends and types of collaboration, including specific areas like patentability, innovation potential, funding. And each of these three pillars, we then assessed them against a list of 25 different key indicators. We then generated a structured database using Permed as a primary source of data for the period between 2011 to 2020, and we complemented the database with other publishers' sources like Scopus, Web of Science to populate relevant metric data. Using this approach and methodology, we found 4,340 publications in personalized medicine related literature in Africa. And we have identified more than 3,000 institutions that were involved in all these publications, including institutions in Africa and collaborative institutions elsewhere. We then mapped all the generated fields, such as citations, number of articles, thematic areas. We mapped these fields, among others, to institutions, countries, and authors. And that helped us to generate more evidence-based findings and draw some insights about areas of mutual interest, capacities, and collaboration magnitude. We found collaboration landscape of personalized medicine in Africa to be relatively large, with more than 100 countries involved. 70% of all publications that we have identified were based on international collaboration. And almost 60% of all the publications have the first author from Africa. The growth of publications, the growth rate of publications over time showed a gradual increase, with a relatively remarkable increase in 2015. The increase in this period might be linked to larger scale projects being implemented during this period. Corporate collaboration is very limited. We found that to be very limited, with only few companies involved in Africa. On the other hand, medical centers and hospitals participated with significant percentage in personalized medicine related publications. Almost 34% of personalized medicine publications have at least one hospital in Africa or a collaborative country. As indicated before, international cooperation is relatively large in Africa, as evident by the co-authorship analysis. And the slide shows the number of co-authored publications with the different African countries. With respect to top collaborative countries, USA comes first, while with respect to regions, Europe comes first. And regarding African collaboration, it was found to be low in volume, but continuously growing. And we also noticed that bilateral collaboration in Africa is more observed than regional collaboration. In general, regional collaboration within Africa, North and South collaboration is extremely low. Some countries are more active in African collaboration, such as Nigeria, South Africa, Kenya, Uganda, and Ghana. And this is a simple comparable view of the number of publications per each African country and the number of co-authored publication with the corresponding European institutions. As you can identify, the top 5 collaborative countries in Europe are UK, France, Germany, Italy, and Netherlands. We found these countries to collaborate with a diverse list of institutions in Africa, especially institutions in South Africa, Egypt, and Tunisia. And that's aligned with our finding regarding the highly productive countries in Africa in personalized medicine research, where South Africa comes first, followed by Egypt, Tunisia, Nigeria, and Kenya, as shown on in the figure on the left side. In general, European collaboration increased significantly starting in 2013 and reached its peak in 2019 with more than 350 co-authored publications with different African institutions. And as I mentioned earlier, non-European collaboration is also obvious, with a strong presence of USA, Canada, Australia, Saudi Arabia, and Japan. With respect to classifications, the classification of the publications according to disease categories and research areas, we found that almost 82% of all the publications, all the publications that we have studied could be related to 13 disease categories. It is clear that there is an interest in infectious diseases, and that include bacterial, viral, and parasitic infections. And there is also a growing interest in cancer research, followed by immune system and nervous system diseases. And those were more pronounced than other disease categories. We compared also the number of articles in 2020 and compared to the baseline 2011. And we found a remarkable increase in bacterial infections related publications, almost 14 times increase in 2020 compared to 2011. And cardiovascular diseases also showed 11 times increase. With respect to classification of personalized medicine publications in Africa based on prevention, diagnosis, and treatment, and while looking into top institutions and the countries, it is obvious that South African and Egyptian institutions, such as University of Cape Town, Cairo University, University of Stellenbosch, South African Medical Research Council, and the Ain Shams University are the leading institutions with respect to a number of articles. And this applies to diagnosis and treatment-related publications, while in prevention, all the top 5 institutions are South African institutions. with respect to European collaborating countries, the top collaborative countries in each of diagnosis and treatment are UK, France, Germany, Netherlands, and Italy. While in prevention, the same pattern observed with only Spain replacing Italy within the top 5 list. And this concludes my intervention. This was a very quick overview of some key findings, and I would like to encourage you to read the full report available at our website. Now, back to you, Eric.
Okay, in this second part, we are going to present the results of the policy mapping that, as I mentioned before, it's focused on identifying those policies and programs that are funding and guiding the health research activities in the African countries, and with a specific focus on identifying projects and training and infrastructure related to personalized medicine. To guide the mapping, let me see if I can pass the... Okay, sorry. To guide the mapping, we design a framework for analysis that is presented in this slide. You can see the different dimensions we have selected. It's based on the work, the previous work carried out by WHO Africa and the EDCTP to describe and assess the national health research systems. We have added 2 new dimensions that are focused on international collaborations and personalized medicine genomic research that are relevant for the project. And once we had the dimensions, we selected a set of indicators for each dimension based mainly on the availability of already published data from which we could collect without having to spend too much time to find it, especially the science and technology statistics from UNESCO or reports and publications which provided good data for most of African countries. With these indicators, we constructed a scoring matrix that you can see in this slide. It's an Excel sheet, and for each African country, we included the values of the different indicators, and we rated as very high, medium, low, or very low each dimension in each of the countries. We used different colors so that it was more visual and easy to identify the situation of the different countries for each dimension. Once we had the scoring matrix ready, what we did was to attempt to group the different African countries based on the results of this scoring for each dimension. And in this slide, you can see the map of Africa and the distribution of the different countries in 5 groups. The top countries are Egypt and Africa, that rated very high in personalized medicine and genomic research. They have good research activity going on. As it was mentioned before by Amr, they rated the highest in the scientific mapping. They have an important commitment from their governments, and they have programs that are funding specifically personalized medicine research. In the second group, these countries also rated high for personal, and they also rated high for other dimensions. And they also have an important commitment from their countries, so they're starting to do so. In the third group, these countries rated a bit low in personalized medicine, but nevertheless, they had the capacities for health research, and their national health research systems were strong. So they could upgrade to upper groups when they get more funding, but they have the capacity to do so. In the 4 groups, these countries rated lower in personalized medicine research, and in the other values, some cases were better, but in general, they were in a medium state. And the last group of countries, in most cases, it was not even possible to get results for the indicators because the statistics of science and technology are not available. And they rated very low for personalized medicine. This type of information is very valuable for our project because it can help us to better guide the activities we are planning. And when we connect and engage stakeholders from the different countries, we have a good perspective of the situation they have in personalized medicine, and it will help us adapt the work and the training and the interactions depending on the situation of each country. The results of the mapping will be available in our report, in our project website, stakeholders in a workshop that is planned to be held in Nairobi in Kenya in February next year. And it will also, as I already commented, help us to better guide the different activities that are planned for the project for the next 3 years. And this is all. Thank you very much for your attention. Please visit our project website for more information about the project, and also follow us in Twitter, where we'll be posting the latest activities and news about the EU Africa Permed project. Thank you very much.